Okay, so whenever you're ready.
Alright, so today in this debate, I'm supporting Obamacare. Obamacare should achieve universal health care. It's affordable, it has good health coverage, and it's expanded Medicaid. Although Obamacare won't expand businesses, it will keep money in the businesses, and it's like more money to pay off your, it's like to buy more equipment and resources. Obamacare is also, it can hurt young people, but they can stay on their parents' plan until they're 26, which is like a couple years after college, and that way they can get a job and start saving up. And then people aren't fans of affordable healthcare insurance, but they should be, because if you have a normal income, healthcare is less expensive. With Obamacare, you can't get denied for any health reasons other than fraud. Most companies will charge you like for ridiculous reasons for being sick or possibly being injured. It's got about, as of August 2014, it had 7.5 million enrollees. Now it helps more than 16 million. Most important to Obamacare was the expansion of Medicaid. This lowered the income. This was directed towards the lower income Americans, and now they have an available healthcare option, and this option is like it can limit your choice of doctors, but this also makes your premiums and prices go down. One reason people don't enroll in Obamacare is actually pretty stupid. It's because they don't know how it works. People can read up more about it online, but a lot of times people are just lazy and they don't want to make the change. Obamacare has no pre-existing conditions. This means if you've been sick in the past, they can't keep you from coverage. Some insurance companies will not allow us, basically, if you get sick or injured. Obamacare might not be something you want because maybe you're a Republican, but it shouldn't matter because he's trying to help the lower income Americans, and he's trying to offer a more affordable.
Aren't most people in America middle class?
Yes, but for the lower class, there's a poverty rate, and this is directed towards them to help them. Some Americans believe that Obamacare will actually contribute to national debt, but this is actually not the case. It's actually the opposite of that. The Congressional Budget Office estimates that the PBACA will reduce the national debt to $143 billion by 2019 because of the fees and taxes associated with Obamacare. This is why the U.S. should strive to reach universal health care, taking the advantage of Obamacare, and let it help you like the other 16 million Americans. Yes?
If there's fees and taxes and it's for lower income people, wouldn't the lower income people not be able to pay the fees and taxes?
But these fees and taxes are also paid by the higher class, and there's an exception to lower class Americans that are in poverty.
So you're saying the higher class Americans pay pretty much for the lower class?
Essentially they can, yes. And that's one of the, I guess, negatives that they're trying to work out between higher income taxes, middle class, and poverty.
1 minute.
Okay. Some claim that Obamacare, the universal healthcare system, is a good idea and a necessity for America. My group opposes this strongly. We believe that there are lots of better healthcare options and companies. For example, there are so many better companies like Progressive, Blue Cross, Aflac, Geico, etc. Working Americans also pay more with Obamacare. In fact, 59% of Americans are middle class and working class. So they will have to pay a lot more taxes. It's also unconstitutional to make Americans buy a universal health care plan or make them face a penalty. It also will cause more U.S. debt. We have enough debt already. Go ahead.
They're not causing universal debt, they're actually helping it, because with Obamacare, it's taking in the taxes, and they're using some of these taxes to pay off the national debt.
Then how come $926 billion of the debt is caused by Medicare, Medicaid, and Medicare?
That's because they've expanded it, and it's becoming a bigger solution now, and that's one of the positives of Obamacare.
Also, 46% of doctors rated Obamacare a D or an F, and only 25% gave it an A or B. Doctors are, not right now. Doctors are experts on healthcare. They are in a better position than the rest of us to judge the impact of Obamacare on patients. Obamacare also limits your choice of hospitals. Your medical privacy is lost when you enroll, and your medical information becomes controlled by government agencies. Go ahead.
These hospitals and doctors are limited, but they also lower your premiums and prices too.
What if you like your doctor?
Then there's an exception to some of those, but the majority of the people will have to move.
Okay. Companies will also pay an extra $84.8 billion in fees over the next 10 years in drug costs if they pass these fees on to consumers. Health benefits requirements reduce the ability of insurance to offer lower cost plans. Some people say that Obamacare makes it easier to acquire health care. It actually does a lot more to complicate the process. People do not need Obamacare, and it does not work. This picture represents what people have voted for on Obamacare. 53% say those opposed should keep trying to change or stop it, and only 35% hold a favorable opinion on it.